It is 9 o'clock. We can start the, or can we? We can. Okay, I had to check with Courtney. Crow Wing County Committee of the Whole. I think we start with roll call, correct?
Commissioner Hoag?
Here.
Commissioner Barrows?
Here.
Commissioner Lepke?
Here.
Commissioner Franzine? And Commissioner Coring.
Commissioner Coring's not here today and will not be able to be with us today.
Okay. So it looks like our first thing on the agenda is the 9 a.m. Safe Harbor Initiative.
Good morning.
Good morning.
Good morning. As you know, I am Stephanie with the County Attorney's Office. Unfortunately, Bethany was unable to be here today, but I've had conversations with her and she's been involved in many preliminary discussions. This is Kayla Page. She is part of Lutheran Social Services, but the regional navigator with them. We wanted to just kind of go through some information with respect to trafficking within the communities, within the state, and possibly looking at a tool that we could use in Crow Wing County to assist with trying to curb any illicit or illegal activity. I'm going to turn to Kate so she can give you some background.
Yeah, so I'm Kate LePage. I'm the East Central Safe Harbor Regional Navigator, and what my role really is I cover 11 counties, one of which is Crow Wing, to be a point of contact for any expertise on human trafficking, so both labor trafficking and sex trafficking and all of the commercial exploitation that falls within that as well. And I've worked within this role for almost 7 years now and have worked pretty robustly with Crow Wing County. And over the years, we've talked about, as there's been different federal laws and state laws that have made it harder and harder to investigate exploitation and trafficking within our smaller communities. We've talked about different ways to think outside of the box to mitigate risk in communities and provide a healthier, safer community. One of those things that we've talked about is a massage parlor ordinance. Currently in the U.S., we are one of 3 states that does not have any regulation around massage businesses or massage therapist licensing. What we found with other communities that have started to put into place massage parlor ordinances is that they are finding that there's a significant percentage of businesses that have some type of illicit or illegal activity taking place, or activity that wouldn't fall within a public health regulatory response to operating a business. Rochester, for instance, had 67% of their businesses that were doing massage parlor or massage business, massage therapist type activities, that 67% of those businesses were found to have been engaged in some illicit activity. Some of that is things that can be regulated, and some of that was things that ended up shutting down businesses that weren't able to operate on a legal basis. One of the reasons that I'm hoping we can bring this to Crow Wing County is because, contrary to popular belief, we do have one of the highest percentages of youth self-disclosing experiencing this form of victimization across the state. And that's consistently found with our Minnesota Student Survey. In 2019, we found that we had a 1.5% of youth in East Central Minnesota have experienced this form of victimization, which is higher than the state average and higher than our metro regions as well.
Wow.
And then again, we saw that consistently within 2022, that we again had 1.5%, which was higher than both our metro areas as well as the state average as well. So we know that this issue exists here. We just have fewer resources to really be identifying and responding to the issue. And one thing that we've found is that regulating these businesses or businesses like this is one way to curb it, but also create a safer environment for patrons, business owners, and people wanting to work in the field as well. Again, we're one of 3 states that don't have a statewide regulation. nationwide, we find that this is an area that we're seeing an entry into human trafficking or human trafficking taking place. So again, this is really just to mitigate some of that harm, not only to potential victims, but also to create legitimacy for our business owners and give a safe place for patrons to go and get a service as well.
I think it's important for everyone, for the board to understand, we're essentially asking if you are in support of us doing additional research. There is obviously a lot that has to be done if we are looking at enacting a public health ordinance of this type. Rochester has done this, and the city of St. Cloud has done this.
And Waite Park.
And Waite Park. So we are the first that would be countywide, but there are obviously fiscal issues, as well as what worked there, what didn't work there. So we're really here to ask just, are you in support of us even exploring the option of doing this? Because we know that it could be very positive for the community. But we also understand that there's a balance with respect to the fiscal responsibilities that we have to look at and the other things that may be concerning. There's discussion about if we do get approval for looking forward on this and exploring more. Kate has talked about her going out and doing public forums, educating different groups of participants, also talking to business owners to find out what they know about these types of things, and also what kind of support they would have for something of this nature.
We also don't want to reinvent the wheel, so we want to utilize, places that have already implemented these types of ordinances, again, learning from their mistakes, and learning what went really well so that we can eliminate any barriers that maybe were found other places when they were implementing these types of ordinances. The other thing I think is really important to note is if we were to identify illicit activity, the fiscal capacity to investigate one massage parlor is pretty significant. I've been a part of different search warrants after massage parlors have been investigated, and in order to do it that way and tackle it one by one with just a legal law enforcement component it's pretty significant. That investigation took well over a year to even get to the point of doing a search warrant. So if there's ways, again, that we can mitigate that harm with less fiscal responsibility and resource within our law enforcement communities, and we can find a better way to regulate all massage parlors. I think, in my opinion, again, we have to go down into the nitty-gritty of the fiscal components, but I do feel that it would be less of a burden financially on the community.
I think it's also to note that there are many legitimate businesses. And when she talks about illicit activity, it's not necessarily all illegal. It could be that they're not doing enough cleaning, they're not maintaining their areas and the equipment that they may or may not use. As she said, we are only one of 3 states. So that means people who handle massages, they have no licensing requirements. There's no overhead from the Department of Health. There's nothing. There's no oversight. And we're one of 3 states that has that. So we're looking at it through, this could assist with human trafficking, but there's also the overall impact on the community's health. Especially, we have so many people that come to us in the summer months. Our population obviously increases significantly, and this will have a stamp of approval for those places, whether it's a single person that has an office in a building, or whether it's one of the larger resorts. Being able to say that they've been checked and licensed is going to be something that we can look at. But again, what she said, we haven't gone into the weeds yet because we want to know if it's something that you would support us kind of going into the weeds, looking at all the different options, and if it's something that you would support later. But we understand we need to have a lot of background before we go forward.
It's a quiet bunch today.
I know.
I'm waiting, I've got like,
I told her, I said, they're going to come forward and they might have questions and just be prepared and.
But there's a lot of questions to be
Yeah.
asked. And I think that if you're just asking for support to do the research in that, I don't think I have a problem with that. I think that it's a good idea. It's a shame that the state doesn't have better health standards for the operation of any of these massage parlors. And I hate to even use that term because it always has a bad connotation. But in terms of looking at it and the potential, making sure that the ones that are doing it appropriately are clean and not, I guess, unclean. I'm not sure where I was going with that, but that they're doing things properly, I think is no different than if you're going to a hairstylist or you're going to a dentist or whomever. There should be standards for those operations. So for me, at this point, I would support it. I would want to know a lot more about the input from law enforcement, because the investigations, to your point, are going to be tough, and the financial component that goes along with that.
Yeah, and we have spoken with different community groups. Obviously, we can't, without law enforcement having their own city councils on board, it's not a public, but we have talked to them about it, just so they're not blindsided by our intentions as well. So and I think that's part of those community forums as well, is making sure that anybody impacted would have a voice at the table.
And when you talk about the state level, I remember when Crow Wing County was one of the first to put Sudafed behind the counter, and that then became a state law. So, we can always be.
I'm not sure if this is going to fall into that same category.
We can hope.
There's a bunch of questions here, folks, a bunch of questions. Are we trying
Absolutely.
to solve a public health problem with cleanliness, or are we trying to solve human trafficking? Because I don't think those two are very closely related. I would want a heck of a lot more information about that 67% who are engaged in illicit activities. Language is important. Illicit. Is it illicit or is it illegal? Massage parlors. Goodness gracious. I went to college in the 1980s in St. Paul. I could drive down the street. There's one, and there's one. Where are they in Crow Wing?
All over.
Massage parlors. Language is important.
if you
Massage
Google-
parlor has a connotation. Illicit has a connotation. Before this makes any sense, you need to establish the problem. I haven't seen the connection. 67% of every massage parlor is engaged in illicit activity. That's what you said.
In Rochester, when they implemented their ordinance, they did find.
What is those violations?
Yeah.
If 75% of those are a cleanliness issue, then it's a public health problem. If we're seeing people moving into human trafficking because of this, then it's a human trafficking problem. Let's be clear about the fact. There ain't nobody in this room that supports human trafficking in any form, way, shape. What I'm questioning is whether or not this is well tailored to a local problem.
And I think those are things that we know that there's a need for a much more robust proposal to the county board about this. And that's what we want to dive into further, again, looking into the reports of the other places that have implemented these ordinances to see, again, was it, and I will be clear, the Rochester, they do contract with public health at the county, so the city of Rochester's contracting with public health. So it is being administered through public health. But in Minnesota, our trafficking response is embedded within our public health response. So we have decided that human trafficking is a public health related issue here in Minnesota.
Agreed.
So all of our funding is through Minnesota Department of Health. I should say most of our funding is through the Minnesota Department of Health statewide. So there is this correlating component there. And again, what we're saying is we do
That's the
see
question,
this.
Kate.
Yeah.
That's the question. You're saying there is a correlation there? Show me. Because I know that the stings we've done in law enforcement in this community over the course of the past 5 years have been in hotels,
Yep.
not in massage parlors. And so if we're
Yes.
trying to, what are we trying to cure? If it's human trafficking, it sure seems to me like we ought to be focused more on hotels, because that's where it's occurring.
Well, and I think it's twofold. It's, yes, those that travel, that go different places, but when you're looking for the illegal activities, if you have a storefront versus going into a hotel, there are different tools that law enforcement has to assist when it's something happening at a transient place versus at a storefront. So there are issues, and obviously law enforcement would have to speak to that, but when you Google massage parlor, that specific word in Crow Wing County, it lists 35 businesses. And that's everything from the fine line to people that are operating with just one or two of them. There are obviously many, many more that would come about without, where we would find those locations. Again, this is really just, we want to look at it and see if this would be beneficial to the community and what that financial impact would be and how those sources would come about. Kate mentioned that we actually may even have the ability to get some grant funding because it's through public health to help with the implementation if this were to pass the board, when it would. This is a long way out. This isn't something that we anticipate trying to get done in a year. It's going to take a bit of time to get all of these things compiled and figured out so that we truly understand and know what the best avenue is. Financially, again, we just wanted to know if it's something that you're interested in. I recognize what Tim is talking about, that we have all these legitimate businesses, and how do we push those together, and human trafficking versus cleanliness, or what someone anticipates as, well, this is just a Department of Health versus this is human trafficking, and how do those come together, and why is it this that we could use to assist with both of that, and how it is a public health issue.
And if you would, Tim, like me to speak at all to the fact that the sting operations have occurred in coordination with hotels rather than massage parlors. It's not investigating the hotel when they're doing a sting operation within the hotel. We do know that a lot of purchasing does take place in hotels and motels, which is why we have made some changes to hotel motel licensure through the state. So at this point in time now, within 90 days of hire, almost every staff has to go through a training on identifying and responding to human trafficking, and then annually they have to re-up that training to stay within licensure standards. The investigations into a business, because you wouldn't create a business massage parlor front for a sting. That's really time intensive, resource heavy. So in order to investigate massage parlors, which is why you don't hear about stings of massage parlors very often, is because it is so resource heavy to get to the point of getting a search warrant. Like I said, that
Kate,
took a
I can give
year
you
of.
2 examples 30 miles south.
Yes.
Examples. Not in a hotel. 2.
That I gave
miles
to.
south of here. And so I'm really struggling with, because I did Google massage parlor, and what do I come up with? Massage therapy businesses. And I am just questioning how reasonably related to the problem you're trying to cure is the solution you're proposing? And will it move the needle at all? I get what you're saying, and human trafficking is an absolute scourge. I want it to be effective. I don't want it to be lip service.
And again, I think our whole point with moving it forward in a public health response is that the whole goal is to create more regulation and public health regulation around these businesses. To your point, just like a hair salon or things like that. We also know that there is the opportunity to identify illegal activity as well, and in those cases, it's just one additional benefit to the overall ordinance. But again, there's a lot of research that needs to go into it and a much more robust proposal that needs to be made. We just wanted this initial conversation to take place, again, just to get a pulse for where we're at as a community, as a county board, before going into it, because it will be a pretty heavy lift from multiple departments to propose that robust ordinance and plan.
And I think, knowing what your questions are, that also helps shape the information that we obtain from the communities who have already done this. I think it's important to look at those types of things and really figure out what you all prefer and really have questions about. And that's why we did this instead of doing all of this work and then, oh, here's an ordinance that we want you to pass. Because I knew there would be questions, and there are physical issues that come about, and we have to have that connection, and we wanted to have something from the board telling us and allowing us to explore this and get the information that you have. On Tim's point, if it looks like, no, this isn't an issue, or there are things that happen behind the scenes that we're not aware of, we need to get and flesh that information out and then be able to bring that information to you.
I have a few questions, if it's okay. So there's 47 states that do license massage parlors or masseuses or all forms of, that's a question. Then why is there the 3 states that aren't, us and who are the other 2?
Wyoming and Kansas.
Okay.
And Wyoming has submitted a bill.
Yeah. I look at more of like with beauty salons, barber shops, all those people that are involved in that, having the state, with the state license, they have to meet certain criteria in order to be able to do that. I see it more of the state getting that involved in it. Where is that? Is there anything at the state level now that they're looking at? It's not even on their radar?
So in the conversations that I'm privy to with the state, it is not. We have other things on the agenda in relation to public health and our trafficking side of things, which is obviously the conversations that I'm privy to. So we would love to see it become a statewide regulation. As of now, that's not what it's looking like. I will say Kansas does have city ordinances as well in place in various areas as well. So I think that there's this general idea that there does need to be some regulation.
And the other question then is, when you look at the 7 metro counties, none of those cities or those counties have any ordinances in place at all.
Not that I have been made aware of. I know that there are other places that have tried to venture down or have ventured down. I think that there were some places that were looking into it and then COVID hit and it kind of threw a wrench in a lot of plans as well.
And then in Rochester's Olmsted County, St. Cloud is Stearns County, those are fairly substantial counties, and they haven't brought it up at their county level at this time. I wonder if is it not here yet? Or is it here yet and we're just ignoring it, or is everybody else ignoring it too?
Kate probably has better information, but I think it's probably, it's happening here and we just don't know.
Every time we've conducted a sting, we find people. I don't think there's any question it's here. The question is to what degree. And that's why I'm so passionate about it, because I know it's here.
Well,
And I
and-
want to make sure that what we do is going to actually move that frickin' needle. I also want to refer you to our sexually oriented businesses ordinance. It's an ordinance already in place. It defines massage parlors as a sexually oriented business, but excludes physical therapy. There is already some, and that is a public health ordinance. And so I agree with Kate that it is a public health issue. And I think it is present here. I'm questioning whether or not what you're proposing is going to move the needle. That's it. I want that needle moved.
And I also want it moved, and that's my whole
I know.
job, is to find different ways to better identify and respond without overburdening any specific discipline within our
Legitimate
communities.
business.
Huh?
Yeah, a legitimate business.
Yes.
We don't want to
Yeah.
inconvenience a legitimate business doing massage therapy. Good gosh, my wife goes to massage therapy,
Mm-hmm.
and she gets it from a nun, so I'm pretty sure we're
Oh,
safe.
boy.
Yes.
I can't get that image out of my head at the same time as I know there's human trafficking.
And again, this is
And
just
so
one
I don't want to
area.
go after the nun, but I want to go after the other one.
Yes, yep. And this is just one piece of the puzzle. And I would love to continue to come back to you with more ideas in different ways that we can be implementing better responses as a county, as communities, to be identifying and responding to the issue. Because it is very much so present here, again, East Central Minnesota. And the reason the Minnesota Student Survey doesn't break it down into counties is because they want to remain they want the disclosures made in that survey to remain as anonymous as possible for youth, right? But we do know consistently we have some of the highest numbers. When we look at things that cause trafficking and exploitation, it is vulnerabilities. So communities with less resource, less 24/7 access to services, fewer shelters, less economic growth opportunities or affordable housing opportunities, we're going to see an increase in exploitation and trafficking, as well as drug and substance abuse and use. So we do know it's happening in our community. I'm very passionate. I'm from this community. I would love to see more things in place to regulate the exploitation of people. And this is one step in that direction. Again, at the same time, creating a healthier, safer way to access a service. So again, twofold. We want people like your wife that are getting physical therapy to have the beds cleaned and, to have regulation on the sanitation of the business as well.
It's just, I want to be clear about what we're trying to accomplish.
Yes.
Sanitation or human trafficking.
Yes.
Because I think if we try to do both with the same tool, oh my gosh, that is disparate purposes.
I would like to see, not Crow Wing County be the one, but some other counties, looking at doing it. Right now, of the 87 counties, there is none that actually has an ordinance in place at this time. And of all the cities in Minnesota, it is just those two right now that have it.
Nope, there's multiple. So St. Cloud and Waite Park have both passed. They've worked on Sartell as well. So I also serve Stearns County.
Sure.
And one of the things that and the reason why we talked about trying to take a stance and make this county-wide instead of city-wide is we don't want to just displace this to the next city, to the next city, to the next city. Because that's what we did find. It's passed in one city, and then those illicit or illegal businesses that don't want to follow the ordinance just move from that city to the next city. So instead of displacing it within our own county, within our own communities that are so intertwined here in Crow Wing, that's why we wanted to assess whether this was something we could do county-wide. Because we don't want it to move to the smaller and smaller and smaller communities or townships that don't have any authority to regulate or have even less authority to regulate.
Just having you here, I didn't realize that massage therapy or whatever is an unlicensed enterprise in Minnesota to begin with. I would think with those same issues as far as health and sanitation and stuff that it would be. I'm kind of shocked that it isn't, that you don't have to get a certificate to be able to do that at the state level at this time.
Well, and I think, as Kate points out, moving from one city to another, that's, I think what they're finding is the ordinance passes and there are storefronts and they, instead of getting a license, they up and leave.
Move to another city.
Which says a lot.
So again, that's our hope is we want to be leaders in this state. I think that we have really great community and resource here, and we do have, wonderful things that other communities can base their response off of. We were one of the first counties to develop a countywide protocol on addressing human trafficking, or sex trafficking, I should say. And so, again, I think that we could be leaders in this, I think that we have some great infrastructure and some great collaborative relationships within our county that we could be a leader in this. And again, we have a lot of work to do to bring forth something that's robust that you guys can actually take a look at. We just are hoping to get your blessing to do that heavy lifting.
I'd like to see what the ordinance is in place right now in, in St. Cloud, what that ordinance looks like. I mean, it's kind of a tip of an iceberg here. I think it's, for me, it's learning something that I wasn't really aware of.
Yeah.
And then how that process works. As far as, it's a long ways off for
Yeah.
me. I mean, because there's a whole lot that has to be done with it, and I'd put it back on the state. The state doesn't even, the 50 states, we're 3 of them that don't. Why?
And I'm happy to share out with anybody the ordinances that are in place. I do know that Rochester developed theirs based off what St. Cloud and Waite Park had developed, because they came after St. Cloud and Waite Park. So again, not trying to reinvent the wheel. There are some exceptions to the ordinance in there. Again, some businesses are regulated through, some massage therapists are regulated through other things like physical therapy and things
Right.
like that, where there is already regulation over their business. So there are some exceptions within those ordinances that have been developed as well, but I'm happy to share those out.
And I can see your thought process in looking at doing it on a countywide, because like you get down to, okay, St. Cloud, Wade Park, okay, I'll move to Foley, I'll move to St. Augusta, I'll move to just out of the area, and I can do it and nobody will say anything. So I can see your thought process in trying to get a county to do it. I'm amazed that there isn't anything already in the metro counties for it.
I think that in working in so many counties, there's a lot of counties that don't collaborate as well as Crow Wing County does. And that's where I'm really hoping that we can be, a pioneer in the state for this, because we do collaborate so well in this county.
I think I've said enough. Is there anybody else on the board that wants to
Mr.
say
Chair,
anything?
for clarification and to Administrator Hool, trying to do a countywide policy would require that each of the cities adopt it. Would that be true?
Not necessarily,
No?
no. If we use our public health authority, which is what we did with our sexually oriented businesses licensing ordinance, then that applies countywide. If we use our land use authority to regulate these businesses, then it would not apply inside the cities. I think that's probably why there is more of a push towards a public health approach to this, because it will be a singular approach countywide, not subject to changes from jurisdiction to jurisdiction like land use planning is.
Okay, thank you.
And to go expand on Commissioner Barrow's question, that's one of the things we have to explore. I think law enforcement, who will do investigating if there is an issue? Is it going to be a public health nurse, or is it going to be law enforcement, or is it going to be both? So there are going to have to be discussions with all the different law enforcement communities, because, Cross Lake has their own police department. How are we going to handle that, and what does that entail? So with the short-term rental ordinance, when it was public health, we had muni revs to just look at everything, and there wasn't anything. Law enforcement, I think that was something that was tricky a lot of the time. Is law enforcement investigating this? This is a short-term rental. This is a county ordinance. Why are we going and looking at this? So that is something that will be occurring with the forums, and making sure that the community as a whole understands and recognizes where we're going and what we're looking at.
And since the state isn't really getting behind it at all, I'm looking at where any funding would come from it to support it. If it's usually the state mandates something, then they throw something our way to help, us try to put it into place. That would be where the funding would come from to support a program like this in the county. That would be my concerns.
Yeah, and that's where I think having some time to develop some creative ways to respond to the fiscal demand of an ordinance like this is important. I would like to look into options and talk with the Minnesota Department of Health about options for grant funding to get this up off the ground that would stem from public health. And I do believe that there would be some creative language where we could apply for some that are out there, or that will be out there. This is something that our Minnesota Department of Health and our Safe Harbor response is looking at and talking about quite a bit. How are we regulating these businesses and what are our communities doing? Again, as a Safe Harbor anti-trafficking network, it's an ongoing conversation that we're having with the state.
I really appreciate you coming here today and sharing that, because it's something I wouldn't have heard of unless you came here. And I think you're doing a great job for your organization by getting out there. You just have to keep getting out there.
Thank you.
I didn't have anything else. Is there anything else for the board?
I love your expansion of the definition of human trafficking to also include labor.
Yes, that's something we're really pushing at the state
Yes,
as
it's
well.
not- I don't put it in the same category. The other is a little more heinous, but this is darn near
And-
as heinous.
yes.
So thank you for that.
Yes.
I hope you don't walk away thinking we don't think this is an important issue.
No.
It's a really
Yes.
important issue.
Yes.
Just want to make sure we move the needle, okay? And you are the spitting image of your mother,
I was waiting for that.
and she'll appreciate this more than you. You are clearly as capable as she is.
Thank you.
Thank you for coming.
Thank you.
Thank you for being here.
Thank you.
So we have your blessing.
I think we want more information.
Yes.
Absolutely.
We want
That's
more
all we
information.
want, is we just want the blessing to get more information.
We will.
Thank you.
Yep.
And I will tell my mother that.
She does a great job for us. Holy moly. The apple didn't fall far from the tree.
Next, we have up community service update on work with law enforcement, Tammy, Morgan, and Trish. Bringing up extra chairs.
Good morning, Chair Lubke and Commissioners. Tammy Loick, Crow Wing County Community Services, and today with me I have Morgan Althaus, who is our supervisor of our, sorry, I'll get it wrong, Coordinated Community Response. We're continuing to play with that name. And then Trish Ekstead, who is the supervisor of our Cree social workers in the jail. And I think we're going to start with our presentation part. We did include two, what's up there right now is two documents that kind of explain both programs in a little bit more detail that we shared with you prior. So. Yeah, see if we can get this to play. And we just want to make mention, this is our justice-involved social work areas, so we are doing some other things that are justice-involved with our probation department and within the jail, and I'll elaborate on those in a moment, but this is specific to the two programs that we are doing. Thank you. No sound? Yep. I feel like I hear something, but then no. Well, maybe we can have Chief Davis and Justin speak. No, I'm teasing. Did anyone look at it before?
I didn't look at the video.
Okay. Try it maybe right in there, see if we can get it to. It worked when I.
It worked the other day, and I tried it this one.
I tried it this morning and it worked.
Technical difficulties, the story of my life. Thank you.
Looks like IT is coming up here.
No, we're
A man of
desperate.
many trades. it could be the sound within Teams.
Oh, that could be with shared.
Do we have somebody on Teams? Commissioner Cornings?
He's not on today.
I was curious if this part could be shown without Teams, maybe?
Maybe Teresa could share her screen.
I'm sorry.
Hey, Therese, are you able to share your screen and maybe the volume will work from Teams?
I'll give it one more try, and then if it doesn't, we can move on. We can send it out in advance or after too.
Maybe.
Do you have to authorize her to share the screen? Or is it her meeting?
It's her meeting. Therese, did you catch that?
Maybe they can,
It's,
we can go on. It's fine. We're good. So we will send that out after the meeting. It's a video that we, actually Morgan helped put it together. It does have our community partners, so members from, some of the staff from the jail, as well as our law enforcement community, with some words around what they have thought about these two programs. So the next slide is the sequential intercept model, and I just wanted to just make reference of this. This is, the model that we have been using, I think, to really just like, where do we have gaps, and where can we plug in additional services to help individuals that may be involved in the justice system. And so at Intercept 0, in that very first part, that's where you see like our crisis lines, 988, our mobile crisis team that is offered through Northern Pines, and Northern Pines also now has the Mental Health Urgent Care Center. And so those are resources that people can access before they get to potentially to law enforcement interaction. But they also are now, these are used by our law enforcement community as well. Intercept 1 is when an individual comes into contact with our law enforcement community, and this is where we have plugged in our coordinated community response social workers that are working alongside law enforcement. They are housed, one position is housed in the Crow Wing County Sheriff's Office, and the current vacant position is housed over at the Brainerd Police Department. And we'll go into some of the reasons for that in a little bit. Intercept 2 is the initial detention. This is where our comprehensive reentry social workers do initial screenings. They work to do those initial screenings within 72 hours of a person's arrival in the jail to try to identify needs up front, and then the person makes their first court appearance. Intercept 3 is our specialty courts. As I mentioned, we have our sobriety courts, DWI and drug court, that we have members of our team working on, as well as the jail has now just recently started that impact program, and our social workers are assisting with that, as well as they do meet with individuals while they are incarcerated, trying to connect them to resources not only while they're incarcerated, but also upon release. And then Intercept 4 is reentry back to the community. This is where we're finding our social workers do assist our individuals with coming back into the community. Our social workers that are out, that I work with in our mental health case management and our SUDS team, they many times are open with some of these individuals as they return to the community. This is where our alternatives to incarceration, I would say that program is at, that's ran by our probation corrections department. And then Intercept 5 is probation and parole. All right, we can go on to the next slide. Sorry, that was the Intercept. Oh, are you still trying to get it to go? All right, so right there, sorry, thank you. And I suppose I can do it too from here, right? This thing's working? Yep, it's working. So you don't need the video? We're gonna just let it go at this point, unless you feel like there's something that we can do, but it's fine. So our comprehensive reentry, we also refer to it as CRE. There's 3 major components. This was started in 2018. The board at that time signed a board resolution to reduce the number of individuals with mental health and substance use disorders in our jail. Through the initial screening, we work, as I mentioned, to do that within 72 hours. We also assist our probation department in conducting those MPATs that are required for the court. We take a lot of the same information, and so we do try to work to not have that duplication. As I mentioned, referrals are made while a person is incarcerated, as well as upon their release. We have some programming that we're actually able to offer in the jail, and then it can actually follow them into the community. So our ICTS program and peer support are things that we are trying to get set up for individuals while they're in jail, and sometimes substance abuse treatment as well, and then they're able to continue that upon release. There's lots of coordination and communication going on with the jail staff, law enforcement, and any ongoing workers. We added a mental health coordinator in December of 2022 after the departure of the jail health provider. The staff are here. We have, you guys want to stand quick? Anna Anderson, Carla Drilling, and Maggie Chapin are the staff that are working over in our jail. Thank you, guys. And they're available if we have questions. I think many times funding does come up when we talk about these programs. This program has been funded through our Adult Mental Health Initiative, partially, not fully, our Consumer Support Grant, and through some of the resources, the random moments that we have through our through social services. Legislatively, we continue to advocate for funding. There was a mandate passed last year to provide discharge planning for those with serious persistent mental illness, and we did just learn actually this morning that our AMHI formula, our funding formula for 2025, 26, and 27 is receiving an increase, and so we may be able to tap into those dollars for this continued programming. Troy Schilling and Kara and myself, we've been looking at a grant opportunity through the Bureau of Justice as well. So there are some opportunities. Sometimes they're grants, and they need some time to get those things in order. So.
Are those federal grants?
The Bureau one is a federal grant that we recently were, given some information on. We did look at that grant when we first started this program. I think we're probably in a better position now because we've been doing it a while and we really know what we are doing in the jail and what's working. Okay, I'm going to pass it over to Trish for some of our data.
We just wanted to share some of the.
Now it's not working, sorry.
Critical points of data that thought were worth sharing. Our connections to treatment. Since the inception of the program in 2018, we've increased connections to treatment by 50%. And overall in the last year, it's been an increase of 25%. So 78% of the incarcerated individuals that are met with by our CRE team have had some level of connection to treatment, whether that's a referral to a SUDS treatment program, waiver supports, mental health supports, or while they're in jail, they're getting peer supports and ICTS. So we thought that was worth sharing. And then also the recidivism data.
I got a question for you.
Yeah.
So looking at that last slide, in that 2015, 2020, 2021 and a half, that's when we implemented the program?
We implemented this program in 2018.
2018. And so then we saw that increase. Do you attribute the increase to the program?
I think.
You think so?
I
mean, we don't know.
I think there's a lot of really
A
good
lot of variables.
stuff happening.
Right? There are a lot of variables, but that's kind of noteworthy, isn't it?
Yeah, I think we're very happy to see this number increasing. And like I said, I think the attempt to try to get some of these resources in place before an individual even leaves the jail is, trying to have them meet some of the individuals so that when they get out to the community that they already know what this resource looks like. They already have met maybe that staff person from Northern Pines or Nystrom's. Maybe they've gotten a peer assigned to them. And so it's maybe not as scary as walking through or calling them after they leave. They kind of already have some idea of what these services are.
And I think it's important to give the credit to the actual team who is really creating those relationships with the inmates to develop that trust and that collaboration to to continue to want to better themselves. The other data we just wanted to share was the recidivism. This took a little bit of digging into the data, and with the help of our jail partners, we were able to really pull it together to really show that we have less than 25% recidivism right now, and that's from 22 to 23. We saw a nice decline in that recidivism, so we wanted to share that as well.
So the blue is our 1 year that they don't recidivate, is that right? Within 1 year, and then the gray is the 3 years.
And then the next page is just more on what are people sharing. So I think I know we're hearing some very positive responses from our jail partners as well as our probation partners. The collaboration amongst our team, they're always willing to help out wherever it's needed. And I think it'd be fair to say, Troy, that you guys see some positive influences on your correctional staff as well. Oh, yeah, definitely. Yeah. Thank you.
It's a tough environment. It's a tough environment.
Yeah, I think, helping inmates with forms, coming in when needed to help to potentially, we've had some kind of emergency hospital placements that we've had to work through. I think the team has been very active and available to assist the jail staff as well as the individuals in custody and their families. Sometimes it's also the families.
Mm-hmm.
I can honestly say that in speaking with a few of the jailers, the impact that this group is having is a real positive impact over there. So I think this was a terrific initiative to plant these ladies. They obviously are quality ladies. We could have put poor ones in there and Troy would have a real challenge for himself. But they've stepped up and done a terrific job. And that's the only message I hear out there. So
That's great.
kudos to you guys for everything you're doing. It's a challenging job, and obviously you're able to build those relationships and get some positive outcomes for these people. And the lines on here prove it. The 3-year one, we'd like to see that start to go down. That would be nice, but at least it's steady. And so that's a positive at this point.
Thank you.
Thank you.
Coordinated community response. I'm still struggling with the name a little bit, but I like it. We've also referenced this as, you probably have heard it as embedded social worker, co-response, law enforcement liaison. And the reason that we kind of landed on the coordinated community response as the name of maybe the program and the position is that as we've gotten further involved in this work, that we really do see the staff that are involved in this program as doing a lot of community outreach and coordinating the response between local law enforcement and the different community services and supports that are out there. I think when we first started this, we had a little bit more of an idea that this would be like a mental health response. We have really found that it is not always mental health response, and Morgan will be talking a little bit about the different types of situations that our social workers are responding to. Currently, we have our staff, Tara Kowalczyk, who has been in the program since we started. Go ahead, stand up. She's doing great work. This program started in the summer of 2022. Sorry, I have to think. And as I mentioned, the social workers mobilize community resources to help address kind of a wide array of situations from mental health, chemical health, housing, disability. They create plans for safety and referrals. They establish short-term case management to reduce the potential future of a law enforcement contact. We do currently have a position open, and we'll be interviewing. We have some applicants that we'll be interviewing next week. These positions are currently covered under our ARPA grant through the end of this year. We are in the process of applying for impact funding through Sourcewell, and we have also begun to claim for officer-involved care coordination, which is a mechanism when people are on medical assistance that we can do some claiming. There also, as I mentioned, may be an opportunity through our adult mental health initiative for future funding as well. Morgan's going to go over some of the data.
All right, so what we have up here is just kind of an overview of the last year and the number of call-outs and individuals that we've been able to serve through this program. And I think what I see is the big difference here is between that Q2 and Q3. We knew that there was calls that could benefit from having our coordinated community response social worker attending, and well, one person doesn't have the capacity to meet that volume. So we did have the second worker added in Q3, and you can see that there was a growth in the number of people that we were able to serve during that time. So in 2023, we had 373 individuals identified as benefiting from a social worker after or during a law enforcement call. Out of that, we really started to look at, what are some of the things we wanted to see from this program, and one of those is the ability for law enforcement to clear a scene that maybe originated as a law enforcement call, but something that our social worker can follow up and coordinate the services to free up some of that law enforcement time to make sure that that individual gets the services they need in the moment. So we started tracking that mid-year, and so out of the 259 calls that we were tracking to see if law enforcement was able to clear the scene, we did have 95 calls that did successfully work with. Something that we're looking more into even this year is even a reduction in law enforcement. Let's say 4 officers originated on that call, and our social worker was able to make it so that only 1 law enforcement officer needed to stay to maintain the safety on that call. So we've saw some really good success with that, and we're looking forward to having a second worker here once we have somebody hired and can continue to look at that OICC, or that officer-involved care coordination billing. It's just unfortunately something that one person hasn't been able to respond to the calls and provide that case management for, but we have good hope that with a second worker we can continue to build that part of the program.
Question for you.
Yeah.
How does it work if you have a call from Pequot or Cross Lake for this one person who's providing the service? Those officers are out on scene. Does the social worker drive there?
Yep.
And they hold the scene until?
We do see, and I think Tara would speak to this too, that sometimes those further out calls are harder to co-respond with. When those officers identify that this is really important that we have a social worker on scene, they will hold the scene. They'll wait until that social worker is available to get there, and then she can help coordinate that. Other times in kind of these further out jurisdictions, we are still doing that follow-up afterwards, and that's a big part of the call-outs is not only the co-response, but the follow-ups after an ICR that identified, this individual has mental health needs, or they have maybe they're suffering from dementia and could benefit from services. We're going to get a copy of that ICR notifying us that, hey, this is somebody we would like you to connect with. So even if we can't get to Pequot because we're on another call, or it is further out and the safety of the scene can be secured before that, then we are still making contact.
The rest of the board would probably be nervous to hear me say this, but I've always been concerned about, since we sit here in Brainerd, and so Brainerd and Baxter gets most of the attention, yet we're responsible for every corner of the county. And so for me, in my dream world, I would like to see us look at a more robust approach to providing this throughout the county, where we can actually be there to assist those officers and clear the scene for them and move on with the problem solving that we might have to do. So I know that involves a bit more staffing and.
Yeah, I think Commissioner Barrows, we have tried to do a couple things to try to assist with that. They sure can call. They can call Tara directly, and they can set up a time to go and meet with an individual. Because sometimes when an individual is having some problems or some issues going on, that law enforcement maybe has already been out there before. So we sometimes have done that. We do a Thursday meeting where we do talk about some of these cases, and that's another opportunity for us to potentially just strategize about what we could offer or what could be offered, so if we're not there. So just trying to increase the knowledge for the officers that might be responding, and like I said, and then Tara is reviewing those ICRs. The staff are doing that and doing outreach to individuals. And we can go to the next one. We'll go there first. This speaks to the.
We do that. The state used to have a group that was embedded with the sheriff's department, and that they used to ride along once in a while.
Oh, mhm.
Did they discontinue that program?
Well, I think that that kind of melded probably into what they call our mobile crisis team today. And we haven't talked about this, but I think our law enforcement partners that are here today with us would agree that we have, I think we are utilizing and accessing our mobile crisis team when needed and when appropriate for more mental health calls that our law enforcement officers have been responding to. So that's 24/7. That's available to our law enforcement community for those with, any kind of mental health crisis going on. But I think what you're talking about was when we had some state staff that I think may have, and that was kind of the initial, what I would call our crisis team in this area at that time. And then I think through that, our mobile crisis team kind of was developed. That's what I'm remembering.
Mobile team, how's that funded?
Through a state crisis grant that does flow through the region, through the county.
100%?
No, Northern Pines, the Mental Health Urgent Care Center is not fully funded by our state grant. Our mobile crisis team, we do fund that. They also get third-party payers. The MHI we're funding some of the uncompensated care within that program, but the Mental Health Urgent Care Center is not fully funded by this grant, no. This speaks to just the law enforcement agencies and the number of the calls that we've been servicing, where those calls are coming from.
Mm-hmm. Yeah, and I think when we added the second worker, we wanted to kind of break up the follow-up calls. So to kind of speak to your question, are we reaching out to Pequot? When we have both staff available, it's whichever staff has availability to run up to Pequot. It's not separated in that capacity when we're talking about co-response. However, when we're looking at some of that follow-up, in order to just diversify who's doing what, we did break it up. So there is a staff housed with Brainerd Police Department. She is embedded, or he is embedded in that environment, and they do follow-up calls with Brainerd and Baxter. So we split that in that way. Tara is embedded in our sheriff's office, and so she does follow-ups on our sheriff's office calls, as well as those outlying jurisdictions, the smaller ones, Pequot, Deerwood, Crosby, etc. So any questions on the split of that? I'm flipping a little bit. Okay, so we also look at all of the different assessed needs throughout this programming, and obviously the biggest one and the one that the program really originated around was that mental health focus and the substance use, and you can see that that's a big portion of our assessed services. Additionally, we're working with people on housing. We're working in supporting families that maybe have children with mental health concerns, or our aging and disability populations. So serving individuals that are having dementia episode in the community that maybe need that social worker. Other things that I think we'll just call out that we've seen good success with, just that service connection following a suicide attempt, coordination to detox or treatment programs, parents needing that mental health support for themselves or their children, elopement from our CRS homes in the community. Sometimes I know Tara has done a lot of work with individuals who are in a adult foster care home who maybe need some social work in the scene to get them back into their safe environment. Dementia-related concerns. One that I want to just call out, what we maybe didn't anticipate happening, but Tara did a lot of coordination with an individual who experienced a home fire, did not have a home to return to, and kind of worked through, the insurance pieces, making sure that he had food and that he was taking care of his basic needs, even though he had experienced this very big tragedy in his life. So.
Morgan, on the aging and disability versus the adult mental health, do you separate then, where do you look at aging? Aging, is that person who has dementia, or is that separated there? Because you could have an older person who has mental health issues.
I do believe the way we have the data being pulled is if she goes out on a call and they are aging with dementia but maybe experiencing mental health, and that simultaneously, we're going to be marking both of those things. So an individual may show up in both areas, but it's just assessing all of the services that we identified as needs on
And then
this.
do we take that person, let's say it is they're having problems where they're just not being able to cope in the household because of, they're got to that point where they can't be on their own. Do we then direct that person into a service, whether it be Lutheran Social Services or something else, to get that help? Because we can't supply all that help.
No, and I think that's what the program, I like to describe it as a social worker at the county is a broker of services.
Broker,
We're not
okay,
the
I
one
like that,
providing the
yep.
service, we're the one setting the service up. We're the
Yeah.
one identifying what is
Identify
needed.
and direct.
Providing the resources and making sure that we're not slipping through the gaps of, we don't just give you the service, but we're gonna make sure that you make connection with them to reduce a potential follow-up need.
I think just to comment on that a little bit too is, these services are voluntary, and so many of them, and so, it's really important the social worker engages and tries to offer those resources. Sometimes that's even why that short-term case management can be it can be helpful, because sometimes it does take some time to convince an individual who maybe has been living independently in their home that this situation is becoming, unsafe, and getting the right services and partners to the table to have those conversations.
And dealing with some people in the neighborhood and stuff who've had some challenges to realize they need the help. And since they still are their own individual, they don't need the help and they'll be just fine. And then somebody says, well, why didn't somebody come out and help them? Well, we've already offered them help and we have to go by what they say. And until it gets to that point, so it's kind of a challenge out there sometimes in the older communities, so.
Thank you.
There's no question that this
Well, don't look at me like that.
is a great program for connecting people to services.
Yep.
Where before, the only tool we had in our toolbox was a hammer, everything looked like a nail.
Yep. No, I think it's,
And that's what law enforcement had to deal with all the time. And then the folks would be left to languish and until the next time they called.
no, I think
And
it's
so for the
awesome.
families and for those involved with these calls, I think it makes a big difference. I'm also interested, and probably getting ahead of myself, in the return on investment that is perceived by law enforcement. As the county board contemplates whether or not this should continue to be a priority for funding, what's the so what for you? I see Chief Davis and Chief Deputy. What's the so what from a law enforcement perspective? Does it make any difference to you?
You want to come to the podium?
Come to the podium. You both can come together as long as you can get along.
I've been in law enforcement for over 30 years, and in that 30 years, Dr. Hull mentioned it, we struggle with how to deal with this type of call. We've really had no answers, and very few times in our career do we get opportunities to get help ourselves as law enforcement. I consider this a service for law enforcement and what this is allowing us to do. We get time and time again, these calls happen, we respond, and we don't have the resources to help these people, but social services does. Having that embedded social worker respond with us or even thereafter, giving them information, providing that person with the services they truly need and not a law enforcement response, that I will most likely not have to return to that home in any capacity later on because the services that they're being given immediately with the assistance from the embedded social worker. I can't tell you how well this has been received for law enforcement because it's a tool that I wish we would have had 30 years ago because I think things would be a lot different now than they are today. Tara has been invaluable. I can't say that. I wish that we could do what Commissioner Barrows has suggested, and that is supplying each law enforcement agency in this county a embedded social worker to do what they're doing here. The numbers, obviously, if you look at them, and for Brainerd and Crow Wing and Baxter, are quite significant. Is it because we have embedded social workers here locally? I think so. I think you'd see the numbers probably climb if we were allowed to actually expand what we're doing and we can bring this to the other departments in Crow Wing County. There's people out there that need services that just don't know how to get them. Law enforcement, I didn't go to law enforcement school to learn how to get these people these services. I know how to do a certain thing. I know criminal activity. I know how to put people in jail and to protect the public. When you go to these type of calls, I feel for them. I want to get them the services they need, but there was really never that immediate connection, and we have that today. And I can't thank you enough for allowing us to provide this service for Crow Wing County, and I really like to see it expand beyond what we're already doing. It's one of those things where I don't know what we would do today if we didn't have this. If this goes away for any reason, I can see our numbers increasing in law enforcement response calls, what we have in regards to mental health problems in this community. And you know as well as I do, you look around the United States today and you see what officers are dealing with in regards to the mental health problem and how we have to respond to this. And sometimes it gets to a point where these individuals are struggling with mental health to the point where law enforcement has to take physical action. And then the next thing you know, we're in the newspaper doing obviously some things that we shouldn't be doing with these people. We should be getting them the services they need. This program takes, in effect, that away from all law enforcement have to get involved in that type of situation. It allows us an opportunity to give them the services they need right away, so that never happens. So that I don't have to be that officer put in that situation where now that my career is put on the line because of a response I needed to take because of someone dealing with mental health and he didn't get the proper services. We have that in Crow Wing County, and I implore you, don't let that go away. So, thank you.
You give me a couple of minutes, I'm probably going to take a few from you. So
You're more than welcome to, Chief.
I think
All
this
right.
is really important. I really
is
do,
really important.
Because law enforcement has been out there for years and years and years struggling with something they weren't equipped to deal with. And we wonder why we ended up with front page news stories.
You know, as we look at this information, we look at the data, numbers are important, we all get that. But a lot of this discussion sometime is from a 30,000-foot view. If I can have a couple of minutes just to maybe bring you on a couple of actual calls with us and the community social workers. And, you know, going into this program, I knew the value of this program. But as time goes on, I'm seeing and experiencing the value to this program, which is something totally different. And so just to bring you to a couple of scenes, couple of instances I was aware of to where kind of that cartoon light bulb went off, and it was like, yes, this is why the community social workers are here. One in particular was a female, a mother in Brainerd, that had just been made aware that her utilities were being cut off for financial reasons. Now, I imagine this female, this mother, had some underlying chronic mental health issues she was dealing with, but now realizing that her utilities are being cut off, we're now in an acute crisis, and we are now having suicidal ideations, and she's expressing those to others. And law enforcement gets called for a female, a mother, threatening suicide. Law enforcement's approach during this, what is now an acute crisis, before we had, you know, a community social worker, was we were focused on that acute crisis and really that alone, and that is that they're suicidal. And really the only thing we had in our toolkit was to look at that acute crisis, identify the threat, and more than likely the result would have been they would have probably gone to the emergency department for an evaluation. There would have been some children that would have probably been put on a protective hold, placed into emergency foster care, referred to Crow Wing County Child Protection. And that's how those, you know, played out. Tara happened to be on this call, and what she brought to this was a multifaceted approach to several different things. She walked in there and was able to identify what brought this gal to acute crisis. Well, it's something as simple as her utilities being turned off. Law enforcement has no control, no resources to, you know, remedy that. Tara did, and instantly started a dialogue and explaining how, you know what, we have assistance for that too. We're going to get those back on. We're going to work with you on this. Instantly, this acute crisis, these suicidal ideations are mitigated, and we're now just working with her on a social services component. Law enforcement's able to back away, and moving forward, Tara, multifaceted, the social services needs financially, the utilities. Also, there's still a chronic mental health ailment going on there that can still be monitored and addressed. Tara's in the home at that time, be able to evaluate every portion of the household, the welfare of the child and whatnot. So, that was one where I really looked and thought, wow, okay.
Children weren't removed?
I'm sorry, what?
Children were not removed?
No, they weren't. No, did not need to be. Yeah, exactly. And another one I wanted to share with you, that another moment where I was like, yes, this is why they're here. And and as Tammy had mentioned, so many of these opportunities, people that we're working with, we're looking for them to volunteer for these services, these resources. We need their voluntary compliance. And, when we're working with individuals, we're de-escalating, and I know Commissioner Barrows knows this firsthand from his previous experiences. When we're looking for voluntary compliance, someone that at the moment is unwilling to accept that help, we have to exert influence to get that voluntary compliance. In order to influence someone to do something they don't want to do, we have to build rapport. So it's rapport, it's influence, looking for voluntary compliance. Now, when we're in a home and we're speaking with someone about their mental health, their substance abuse, their criminal drug activity, and I'm speaking to them like this, where's the rapport? And if I don't have that, where's the influence that I'm going to exert? So what was really neat for me is I know a family in town, know them on a personal level, that they took a moment to share an experience they had with the Baxter Police Department and a community social worker. And it was an adult daughter, mental health ailments, substance abuse, which resulted in stealing from elderly parents, and in a family that were at their wits' end. They called the Baxter Police Department. Community social worker responded as well, and they talked about the approach, and they talked about how this adult daughter wanted no assistance, and everything that was discussed, every resource offered to them, this daughter had an excuse why she couldn't, why she couldn't voluntarily, get on board with this. And they talked about the social worker, having a remedy for every excuse that was presented. Well, that still didn't clear the hurdles. But there was the rapport that was being built, one that the Baxter officers were not building, but that social worker was. And the end result that day still did not have any compliance. But what happened afterwards was, since that rapport had been established, that community social worker, over the course of the next week, was able to make a phone call to this daughter and just to check to see how they were doing. The daughter would take these phone calls from the social worker because that rapport had been established. After the course of a week or two, now the daughter called and reached out to the social worker and said, "I'm ready." So we had the rapport on scene. We had subtle influences over the course of a couple of weeks, and then we had that voluntary compliance. And so those are, kind of a couple specific things that we're seeing, and that's really making the difference. The data is important, but, the quality and the abilities that this affords is just paramount. And we're very appreciative for, the support of this program to this point. Thank you.
Thank you.
Thank you, Chief.
Yeah, and this was, again, these were some of the comments that we have received on this program, and you guys did a great job of telling you even more. One more slide, and I think it's just the questions. So questions, additional questions. As we mentioned, our law enforcement community is here, members of that, as well as our staff. So we just thank you for, again, your support of these two programs.
Any questions for the staff?
Nobody's planning to retire, are they? We love you all.
We do lose
Yeah.
staff, yes, we do.
I hope not.
That will happen.
I remember hearing this presentation many years ago in my former life, I guess you could say, and saying, boy, this would be really neat if they ever got this thing off the ground, and it's really nice to see it's off the ground and it's working. it'll be, as Commissioner Barrows said, it'd be nice to make sure that the other departments that are out there, you know, the ones that are further away, know everything that's going on, and I hope they do. I hope you've brought all, I mean, because I know you have a chiefs meeting and stuff like that, so all they're brought into play. I know it's a little bit of a distance, but at least they know that maybe they can call on somebody. We can maybe diffuse that situation right now, but we'll need somebody to come up here and talk to those families and help them. And I think that's why we're here. I think that's why we're here. That'll keep the recidivism rate down. And I think one of the things we don't think about is those kids in that household that are experiencing this. What happens to them if they don't see their loved ones getting help, their parents getting help? What's going to happen to them as they grow and go down the road, down that same path? I think in the long range, I mean, I think it reaches to long range benefits, and I can speak from it personally in my own family. So thank you for being there.
Thank you.
I'll just say one quick thing too, to Chief Davis's point. I can't tell you how many times law enforcement brought somebody to the state hospital out there to our intake room. The minute they left, because that uniform walked out the door, the de-escalation of the behaviors that we were seeing was tremendous. They were doing their job, but that also raised the anxiety for these people that are in crisis at that time. So to his point, if it's a mental health issue, then you need a mental health professional there to deal with it. And they can back off, and then they can actually go do their job. But they're also there to, if they back off, to provide additional assistance if necessary too, because sometimes it does go south. But what I always recognized was that to create that relationship as a person who's trying to help them with their issue is, we're in this together. And here's what the solutions are that we have available to us. So you're not putting them in a corner, you're helping them, and that we're a partnership, where law enforcement has more of a disconnect from that. But as a social worker and doing your job, you're a partner with trying to solve their issue at that moment. And it changes the whole game when you're negotiating with them, because you're always negotiating. So thank you very much for all you guys do. Appreciate it. Whether you're in the jail or whether you're in the community. So thank you very much. And thank you for law enforcement for what you folks do, because it's a tough job. And to the chief's point, a lot of stresses out there every day for them. And I know there's always the individuals who say defund the police. I say that's a terrible term to use. We should enhance what they get, but we should also enhance these other components that help them do their job and to help the community member who's struggling at that moment. So, but I have a big heart, so I have to be careful. My billfold's only this big. So, thank you very much for all you folks do.
Thank you so much.
Thank you.
Thank you.
Where's everybody going?
Must be an early lunch somewhere.
I have to step out for a minute.
I'm going to have to step out for a minute too.
Mr. Chair, we have the next section
Could we-
scheduled at 10:30. We are at 10:23. Can we take a 7-minute break?
That would be awesome.
Okay. Well, it says 10 here, but it says 10:30 on here, so I'm not sure which one. They're obviously not here yet, so I'm hoping they'll be here by then.
Hi, trees.
Oh, there
No.
they are. Oh, okay.
You didn't want to be in here with all the law enforcement?
No, I love being here with them. That's when I feel the most safe, probably.
Like some sort of speaker thing. Not yet, trees.
Nope. I think that makes good sense.
So I'm just talking to you then,
It's going to be a really short conversation. What do you think we should do? Okay, let's go do that.
or? Is anybody online, right?
Yeah.
Okay.
Yeah, we're working on audio right now.
Can we not hear anybody on Teams? Oh, that's inconvenient.
That is inconvenient.
How about now, Therese? Oh, they're talking.
I don't know what Troy touched over here, but he touched something, and it was like a speaker, like speaker options. What was it over here?
We're gonna need, they can clearly hear each other. Yes, you do, I can see that, but we can't hear you guys.
Can you sign time sheets? I need your time sheet signed.
Yep.
And Courtney's time sheet signed.
Yes, I'll sign your timesheet too.
I'll do it right now. Yeah, I don't like that. Yeah.
Should I ask him now?
Was there videos? It wasn't a recording of the Teams meeting, was it?
On here?
Yeah.
No.
You were trying to get to play the audio and stuff. Okay.
I guess, no, I'm not sure what,
No, it was like within their PowerPoint.
Right.
And I tried it.
Oh.
I don't know.
the PowerPoint worked, right? The
The PowerPoint worked up here, but I don't know if it's when you open all the other mixers that, I don't know.
But it was just like a video.
Yeah.
It wasn't like a recording that someone had done of a Teams meeting that they've been in.
I don't know where they got it embedded.
I spent days, I recorded a whole session and found out you can't put a Teams recording, you just have to go and play it in the Teams.
How unfortunate,
Right?
Well,
right?
so who's coming into this meeting? You can, okay. After they're messing with the system sounds.
You got 2 more minutes? Do you want a piece of candy there, Doug? Or you got gum, huh? I gotta have chocolate. All rise, Mr. Barrows is back, or Commissioner Barrows is back. Who's doing that now? That must be him.
Yes.
We're on the computer.
Making progress.
Oops, I'm on projector. Let me go.
Can you guys talk a little bit and see if we hear you?
That was well worth having the chief make his presentation.
Coming through,
Coming
we're
through
coming through the
here.
computer. Nope, yep, okay.
I thanked him outside for that. Yeah, yeah, yeah.
You can see the value in it.
Well, yeah, I could see it back when, I can't remember who was Chief Baxter at the time. Was it Exeter or what? Yeah, I think it was him when they first started looking at doing this pilot program. So,
Ken?
did you want a piece of candy? I got chocolate here for you.
Yeah. I'm starting to wither away.
Did you want Mr. Goodbar? Like, if that you want, I'll go get you Mr. Goodbar if that's what you want. I'm here to serve.
We're working on it,
Chocolate, so I can take.
trying to get it into the room. We can
Oh,
hear
I
you
got
through the
more.
computer, but we can't hear you in the room.
But these have to get 8 and 2, you know.
Oh, okay, so let's go over here.
Yes.
Look at this all there.
What are you doing?
I'm gonna try to suck my gut in.
That's why we're dark pools.
Okay, how about now?
Can you hear me?
Can you hear me now?
It's 10:30 if
Can
we're
you
ready.
hear me?
We're trying to get the audio to work.
oh, okay. Oh, okay.
I think
I was gonna start pounding my gavel.
I think we're getting warm.
I mean, we could do the
No,
ordinance
they stopped talking.
now and see if they can get.
Reese,
figured it
talk
out.
to me.
Hello, can you hear me?
Yep.
Can you hear me?
Yeah.
Yes, we can.
I'm worried about you grabbing it and pounding me on the head a couple.
You can hear me?
You can
Yes.
hear us?
Yes, we can hear you.
Oh, excellent.
Thank you, Jim.
Thanks, Jim.
We're not birded completely.
Thanks, Jim.
We got there.
Paul, who? Our Paul?
And just so you know, we are live streaming. It's still going on the software and on YouTube.
That's why it sits back there.
Oh, I didn't hear that.
We are live streaming.
Okay, good. Let us get back. We have a presentation now in front of us from Land Use Ordinance Update, right?
I think we're going to switch it around, if you don't mind, Mr. Chair. We have our consultants on the line, and so
Okay.
if we can do the comp plan first, then they can get about their business.
Okay, thank you very much.
All right, well, thank you, Mr. Chair. What we have for you today, like we did last month, is an update again on the comprehensive plan. We have our consultants on teams this morning. We have Robin and Dylan, and they're here to talk a little bit about some goals and draft policies regarding housing and economic development. And then we have Matt Calrus with Highway Department going to talk a little bit about transportation, the goals they've put together and policies. And so I think at this point, I'll just flip it over to Robin and let her take over the show.
Thank you.
Great. Good morning. Good morning, everyone. Good morning, commissioners. Happy to be here again with an update on the comprehensive plan update. As Chris mentioned, we're going to give a little high-level overview of where we're at with the project. We're going to go over the goals and draft policies for the housing, economic development, and transportation chapters, and then give you an opportunity to provide any comments, and then also give an update on our next 3 months. With that, the little red line keeps marching along our table here. You can see we've got a lot of engagement that's complete, and the website is still up and still getting visitors. You can see that we're started drafting almost all of the chapters down in the orange section towards the bottom of the table. So we are moving quickly towards spring and summer, when we're going to be going through the process of sharing the drafts again with the public, and public comment period, and eventually adoption. So it's exciting to see all this progress that's been made. As far as engagement, we have continued to engage the public. We have been posting, we've been making these meetings live. You can see here on our website, we've actually added the video of these recordings, and we've communicated out to the public via press release and some emails out to folks to let them know that they can either attend in person or go online and watch these videos just to get an update on where things are at. And on March 6th, Administrator Tim did do a great interview with WJJY that has been shared on the county's social media page. So if you haven't had a chance to listen to it, he did a great job in just talking about the comprehensive plan, what it is, and where we're at in the process. And then, so with that, unless there's any questions, we're going to jump into some of the goals and policies for housing and economic development, and then Tim, I believe, is going to be going through the transportation goals and policies. So I'm going to start first with housing goals and draft policies. The goals should look very familiar to you. I'm not going to read them to you, but you can see, if you recall from the public engagement, these two sections, housing and economic development, were actually the two top-rated issues or concerns that community and the public had. In particular, with housing, it was just the need for more housing. You know, we're hearing employers don't have enough, you know, they can't attract employees because their employees can't find housing. We heard a lot about senior housing. That was probably one of the bigger issues. 48% of our survey respondents indicated that more senior housing is needed. So you can see that reflected here really in just the need to support development of housing, and of course, you know, balancing that with natural resources and retaining the community character. And so on the side here, you can see the draft policies again, just promoting, you know, promoting development and housing for all income levels and abilities, especially workers and seniors. In addition to senior housing, you know, 2/5 or so of folks thought additional apartments and rental properties were needed. So again, talking to more of this life cycle housing, mixed use developments, and again, just making sure that they're connected with nature, natural resources, and recreation. So I'll let folks, like I said, I'm not going to read them to you, but was there anything that folks, you know, does this look like it's really reflective of where the county wants to be, kind of what your goals are and policies are? If there's any comments or questions folks have about these?
No.
Yeah, I don't hear any, so I think
Okay.
Unless there's anything else, we can move on to the economic development goals and policies.
Okay. As far as economic development, again, this was one of the top issues. When we did survey folks, you know, we did hear that people felt like they had most of the resources that they needed. And we of course know that Crow Wing County has a lot of business and economic development around tourism, vacation-oriented businesses, et cetera. But, you know, there was definitely this interest in making sure that there was a diverse business environment, and that really gets to that sustainability and resiliency. So, you know, as markets change or income level and tourism changes, you know, there's a good diversity of businesses to really stabilize and make your community stable. So you can see diverse, just kind of picking up on that, the, you know, diverse business environment, supporting businesses, especially those that enhance tourism, and also improves quality of life. And then also there was some conversation about redevelopment and addressing some of the blighted properties. So again, see if there's anything on the draft policies that I wanted to focus on, but that's probably kind of reiterates some of the main themes again that we heard from the public and in our conversations. Maybe to talk a little bit about some of the next steps. You know, we're taking a lot of this, taking these goals and policies then, and we're actually going to be translating it into the land use plans. And so at our next meeting, our meeting next month, you're going to see how some of this is playing out in on the assignment of our future land use plan and where we're proposing different land uses for economic development and housing.
Any questions about economic development? Any of the goals or policies? Any questions or thoughts?
Number 3, it says increases support for local tourism, vacation-oriented business and non-seasonal business. What's the difference between tourism and vacation-oriented business?
That's probably not much of a distinction. I guess they probably, when you think about it, they're probably fairly similar. Do you think it's redundant and maybe?
So as I read this, my concern was the third one, which is non-seasonal based economy, and it didn't seem to get the same attention that the tourism/seasonal was getting.
Mm-hmm.
And I would want to make sure that our non-seasonal base is addressed equally or more robustly as tourism and vacation-oriented businesses, but I think they all have to be on the same level in terms of the policies so that we're supporting both ends of the spectrum there.
I think we can wordsmith that to, get that so we show that more balanced approach in that area. I think we can wordsmith that.
You know, the word non-seasonal, it kind of discounts it. You know, I mean, it's the businesses that are here for the 365 days a year, carrying out that, really, I mean, that's our base, and the seasonal, the vacation business that, that's I always looked at it as that's the gravy over the top, but we still need our base to be here.
Yep.
We've gone a long ways from being just that, Crow Wing County shuts its doors in August and opens them back up again in May. We have a lot going on up here, and I think we need to balance those two, and especially when you're talking about economic development. There's a lot of people out there right now that have nothing to do with the local tourism, but that do a lot of business up in this area. So I just want to make sure that we don't look at one with a big, bright focus and not really identify the other one as strongly as we could.
I think that makes sense. We can wordsmith that and
Yeah.
we'll take care of that.
At least that's what I see.
Yeah, great question. We'll definitely refine that.
Are there any other of the goals or policies, excuse me, that you have some questions or thoughts about?
Not on that one.
Okay, well, super. I think we'll just jump then into the transportation goals. That's the next 4 slides. And it sounds like Matt's going to take the one on this.
I'll take it. Mr. Chair and Commissioners, us at the Highway Department, we have sat down for the last couple of months, had a couple of meetings, and came up with policies and goals that we thought reflected the existing and hopefully the future transportation system in Crow Wing County. We took the old goals and we kind of scrapped them, and we tried to come up with some newer, modern goals that are hopefully used in a more efficient way going forward and last these next 20 years. So I think this is the first time, unless you've obviously read the packet before, but the first time seeing these goals and policies. I'll walk through them on a high level. And Tim and I were joking before, but we do have the most goals and the most policies of any chapter so far. So, and this is the condensed version. So, but any questions, either myself or Tim are happy to answer those. And so looking at the first goal, very high level and broad, looking at maintaining a safe, cost-effective, and efficient transportation system. And then just running through quickly on the policies, we want to make sure that any land use decisions that happen in the county, those fall in line with our county roadway safety plan and also the highway improvement plan, which is the 5-year plan of projects that we will deliver. Also looking at local and state highway system planning, we want to make sure we're using our land uses adjacent to our highways in an efficient way, and that coordinates with their planning efforts. Thirdly, working with partners to identify and coordinate the transportation system improvements and looking at growth and development. I know sitting in on DRT meetings and the Planning Commission meetings myself, I think we've had a good hand in most of those developments that have come forward in the year that I've been here. And then lastly, pretty straightforward, plan, build, and maintain roadways that can handle the existing and the future traffic growth. And that'll be driven by the land use. So I think what we see a lot in the transportation chapter itself and the goals and policies, it ties in with almost every other chapter in the comp plan, whether it's land use, housing, water resources, they're all connected. I guess for this first goal with the policies, is there any questions on that one? All right. The second one, this is looking at accessibility and mobility needs for all users. The main point of this is looking at trails, regional planning, and you will notice the first policy where it says plan for trails and other facilities that connect destinations and so on. And the third policy, support the creation of a continuous network of non-motorized trails. They're very similar in verbiage. I think we'll end up landing on one of those. If you guys have a preference on which one you like reads better, or we can we can wordsmith it ourselves with the help of the consultants. But I think combining those in some manner, and then Tim and I were just talking actually before I came up here, and one we could throw in if we take or combine those is some sort of balance of infrastructure between pedestrian and road projects when they come about, since this is looking at accessibility and mobility. If you're going to have a trail network or any way for people not in cars to get around the county highway system, you needed them to safely cross roads. So that'd be something that we would have to wordsmith further at a further date, but I think it would fit well with this chapter, I mean this goal.
Looking at it, the first policy that you have up there defines more clearly who we're talking about, but we also are doing a comprehensive plan that's way up here. And in talking with Tim and I think a little bit with you, Matt, the third one still recognizes the efforts to try to provide opportunities for all of those users also. So I wouldn't be disappointed with the third one, simply because the comprehensive plan is a 30, 40, 50,000 foot look at the operation. But I really want to thank the Highway Department for addressing this. I know it's a concern that I've had over time, and I think that you've done a great job of looking at it and saying there's opportunities here. And, you know, with some scalability and looking at where it makes sense, I appreciate that very much. So,
thank you. Yeah, and I think having verbiage in here, policies that hit on trails, that'll help in future grant applications too. I know we had multiple come through this last year, and this will just further be a point or a specific item we can point to where it's clearly defined that this is something Crow Wing County supports. So.
And I don't think I read the third one at all like you do. It says non-motorized. Where's our motorized? We have to have that in there too.
Okay.
I know I've received some comments from some of our ATV clubs who would like to see something maybe in the comp plan that would address that idea of sharing trails, especially for like bridge crossings for connections and things like that. I think is important. Yep. You know, so I don't think when I talk to the ATV clubs, I think they're pretty content with the way some of it reads now, but just want to make sure that connections to them are a big deal to get from this spot to that spot, and to be able to share, some trail spaces to get would help.
It has to say motorized also.
Yep.
Okay. Yeah, I know some, if not all, of the grants I've seen for trails and such, some of them do require non-motorized, and if some of the verbiage gets thrown in there, it might throw them off, but
That's why you might want to leave both.
There's two policies.
Yep, you might want to leave both. The first one, focus on multimodal. Add your motorized uses there, because it's one of all of the different modes of transportation that the policy is mobility, right? How do we move people, goods, and services? So think about the first one as that multimodal component. Think about the last one as the one you're going to use for that grant.
Okay.
And we're also trying to create non-motorized trails. What it allows us to do is, for the one purpose, this is our plan, and we're looking at all trail uses. They have to coordinate with each other, they gotta work together, they gotta play nice in a sandbox. That's what the first one's about. The second one, or the third one, is really about grant opportunities. And I think
There are grant opportunities for motorized too, so just add a fourth one
that first one
where it says motorized.
there's a variety of ways to get there. That would be one, so.
Yeah, I think one option, Matt, and we're just chatting quick, is maybe on that first bullet where it says non-vehicle users, maybe we include there that says motorized uses, so that could, maybe include that there, and then that bottom could be clear about the non-motorized piece maybe, so that's very clear in there.
It just has to be clear that we are
Supporting. motorized.
We never have a problem. We never have anybody who shows up if it's non-motorized. So I'm more concerned about the motorized trails.
They tend to attract more attention.
Yep.
But
We
they
can,
also have a great need in this county.
I think we can wordsmith that too and make that work, so.
I don't know where this falls under, if it falls under transportation or whatever, but in the district I serve and also serving on the Central Minnesota Council on Aging, trying to figure out a way of getting transportation for some of these people that are out there, you know, and down in Brainerd with the bus service we have in Brainerd. Where would that fall, if it doesn't fall under here, where would that fall under the comp plan that we want to also make sure that we have those people being able to, by a transit type system, get to where they need, however that system is set up, whether that system is set up as the one here in Brainerd Baxter, which pretty much sends up by the bus, but in other areas, there's other ways of doing that. I don't know of any place we have it, and I don't know where you'd put it. And I guess we have consultants that tell us where it should go. But, you know, for those types of people that we have that need transportation to the doctor, to the grocery store, to wherever it is, where would that be put in the plan, or is that not even part of a comp plan? I would think it would be part of a comp plan because we're looking at the overall county. So I need some help with that.
Yep, I know when we were sitting down for the highway meetings, trying to come up with our goals and policies, that was one of the areas that came up. We might dive deeper, or we will dive deeper into that in the long-range plan for the transportation side. I do think it will be a part of the comp plan. Robin, if you want to chime in at all, but I foresee it as, and looking ahead, it's not in our goals or policies, but I would figure there'd at least be a paragraph or two. I've seen that in other plans.
Yeah, where would you put it in the plan? If it's not in transportation, where in our comp plan does it go? That's just.
Sure, this, Commissioners, this, transit service would definitely be addressed in the transportation chapter. We do have some draft language in there already describing the existing system. So I think the discussion might be, do we want to add a goal or a policy under one of these about transit?
Okay.
Or shared mobility type service.
Okay, it's in there, but it's not in there. I mean, this is where it would be. It's just not in there yet.
Well, I think the discussion right now, as we draft this chapter, is about existing. You know, it's what's now. I don't think it really speaks to what, the comp plan future would look like. So that might be something we would address in a policy as what is under one of these goals.
But the existing is already there for part of the county.
What is existing today, and then what is the desired future for, in 17 years from now? Yeah.
Okay, just want to throw it
I
out
would
there.
describe that as the most robust transit system we can afford. That's how I would describe it.
Yeah.
Because you're going to have that constant trade-off between the cost of providing that unit of service
and how to get it there, and the need.
That unit of service. And we just went through that,
Yep,
right? With some folks who want to ride the bus, and we can't afford to send it there anymore.
Right.
So to me, it's that balance between, in a perfect world, if money wasn't an object, we'd have a countywide transit system. But it is an object. Therefore, I think that's the balance.
And I know we've talked about, first thing is, you hear about it, but then what are the facts? What is the actual need study? And I think that's where we're kind of, but where would it be in a comp plan? And this is where it'd be under a transit.
Yeah.
I see Tim up there. He must want to speak, or else he wouldn't be standing at
Just
the podium.
Tim's last point, I think there's a lot, in a lot of these goals from the other departments too, it really is a balance.
Right.
We don't have enough money to do everything, and so there's going to be trade-offs. The other thing I wanted to say, and that was great, to point out that transit's not in here, and it should be at some level, but also think about, and it's only because we're just not focused in these areas yet. We have not talked about the airport in transportation. We've not talked about rail. We have not talked about freight. Specifically, it's not as, right up front for us like many other counties. And so there's the airport. We should maybe have something about that, and we have not focused in on that. And Robin and Dylan will take some cues from you, about what that might look like for us and what we should be saying to support those. That's a balance. We're not actively investing in the airport, but we might need a road system to take the freight from there if that happens, or something like that. So you'll see that those are missing, and that's probably a couple areas like transit that we need to touch on a little bit more and need a little more time to refine those.
Correct me if I'm wrong, but when I think of a comp plan, if I'd never seen Crow Wing County, I should be able to grab their comp plan and be able to say, what's going to go on in Crow Wing County? What are they looking at? What are their long-range goals for Crow Wing County? That should be what I think is a comp plan. And I would have a pretty good idea what's happening, where we're going, where we're at, where we're seeking to, and what we have. You know, it should be almost like a whole. Am I wrong there or not?
That's what the plan will look like.
And so if we're missing a thing like an airport, if we're missing a thing like transit, it doesn't really give me, as an outsider looking at it, what's going on in Crow Wing County, or what our goals maybe are, visions and stuff, so.
Well, and I think the ticket too with this is that if everything's a priority, then nothing becomes a priority. So we do have to sift a little bit.
Right.
Because if we pick too many things, we'll never get anything done.
right.
So at what point where does that stuff rise to the top and that sort of a thing? So
One
that's just
might
a
be a
consideration to
paragraph and
make.
one
Yeah.
might be a sentence.
So we can't include everything because then
Right.
we'd have a 500-page book that we'd never use, so.
I think rail would be a great example of a mode of transportation that we probably don't need.
I would
in the comp
agree.
plan,
Yep.
Because we don't get involved in
No
it.
influence.
They have rights in their domain. There's all sorts of reasons why
Mm-hmm.
we just don't plan for freight rail. The state of Minnesota does.
Right.
So that's an example of, it's a mode, but I don't know that I think we need that one. But if the mode is in the county, well, then we probably should
Yeah,
be
it's,
talking about it.
it's a sentence that says that Crow Wing County is served by rail. I mean, that's the most that would have to be in there.
There is,
Yeah.
because I don't think we're planning the future of it.
I don't know.
Just throwing it out there.
Any other questions or comments on goal 2? All right, we can jump to goal 3. And this one is looking at the environment, health outcomes, sensitive ecosystems, historically, culturally significant sites, and tying that in with the adjacent land uses to the highway system. So ties in with water resources, natural resources, that chapter as well. All the policies, looking at realignments when we're looking at that for roadways, taking in all the environmental factors, weighing those on where that road should be built, balancing strategies and best management practices when planning, building, maintaining the motorized and non-motorized transportation network. And then lastly, seeking opportunities for new wetlands or habitat credits for mitigation for that future transportation system. And most of these are, I don't want to say straightforward, but a lot of these tie in with all the project requirements and grant requirements that come with every project that the Highway Department deals with. Any questions, comments? All right.
And I would
I'm just going to throw out vistas. You know, when it was brought up, I think, in land services or when we start talking about billboards and billboard signage and stuff like that. Is there anything about line of sight or vistas or views? You know, when I drive in the southern part of the county, I see this beautiful savanna when I'm driving like 45 out of the county. Do we talk about that? That isn't really a transportation thing. That's just, you know, when I drive into Crow Wing County and I look at it, do I see nothing but billboards and like a metro area, or am I seeing over the top of wetland, driving by Gull Lake or North Long and stuff like that and looking at it? Is there anything that, I'm just throwing it out there because it's, I don't know if you'd even put it in a comp plan or if it's just how do we look?
I think your focus, if you're in the car, then you're focused on what you're seeing, right?
Yeah.
You're not focused on the road.
No.
You're focused on what you're seeing. And I think that's land use.
And that's what?
Land use.
Land use,
And the
okay.
sections on land use and/or economic development, where do we want certain things to occur, right? And a
Right.
sign would be one of them. The road and where we want the road to occur, and
That's
what's
this.
the purpose, and what are we hauling to and fro, and how are we gonna go about doing it?
That's in here.
That is paying attention to your driving on the surface you're on. But what you described, I think, is land use.
Okay. Thank you.
And I just want to point out too that if, you know, we're asking for some feedback today, but if you have some comments or thoughts, feel free to reach out to us afterwards, you know, talk to Matt or myself and you know, if you have, once this meeting's over and you have some other thoughts, this isn't the only place to interact with us, so feel free to reach out to us if you have questions or thoughts.
All right, and then that brings us to our 4th goal. And this is looking at preserving and modernizing the existing transportation system. And so a lot of this has to do with, you know, EVs on the rise, charging stations, and ultimately in the future, who knows, 10, 20 years, what kind of cars will exist. So This is what we came up with for kind of prepping that unknown, but we want to support and emerge the technology that are related to vehicles, improve the planning, building, and maintenance of our transportation network as well. Funding-wise, all the grants, funding opportunities, looking into those to preserve, maintain, expand, and modernize the transportation network. And then this kind of goes in with freight movement, but looking at a continuous network of 10-ton roads to accommodate the freight throughout the county. That's not saying every road will be 10-ton, but where that fits in and how we can create some sort of continuous network. And that'll be hit on more in our long-range plan as well. And then lastly, with local partners and local jurisdictions, their land use regulatory impacts, whether it's road realignments, right-of-way acquisition, or the access, make sure those are properly addressed. So that future traffic generated or future anything with safety, planning, that all exists with our opinions and our feedback on those projects or proposals. And I think we've improved on that with working with local townships, cities, attending most of their public meetings and such to weigh our factors and our findings of fact on their proposals. So, any questions or comments on the 4th? We could have had 6 or 7, but we're at 4, so that's all transportation for now. And I'm sure all the other stuff we left out, that'll trickle into the long-range plan, and you guys will be a part of that as well. So, thank you.
Any other questions? Otherwise, we'll turn it back over to Robin, and she'll kind of give us a quick summary of the next 3 months of kind of where we're heading. And then I'll close out with just a little bit of a summary of just maybe more of a timing, how we think where we might end up timing-wise.
Thanks, Chris. As I kind of alluded to in the beginning of the meeting, we are going through we're going through and drafting chapters. So following this discussion, we're going to, we're going to finalize the housing and economic development goals and policies. And we do have a good start on drafting the chapters. So now we're going to start looking at we've got a good description of the existing situation, existing conditions. Now we'll start drafting for the future conditions, future plan. And so we're going to be starting to finalize or draft some of these chapters and share them with staff for their review. And the goal being that around the end of May, early June, we'll have all the draft chapters for you, for the board to review and to start doing some public engagement, sharing the drafts, providing a comment period, and eventually going through the review and approval process. So it looks kind of busy, but we'll be back again. We're proposed to be back again next month. And at that meeting, we'll share the land use section. We're going to talk about land use, and we'll have a proposed draft future land use map for you to look at. And we'll also start talking about the facilities and infrastructure section. So that is the plan for next month.
All right, well, thank you. As you can see, I think we're kind of a month ahead, really, on how this is set up. So I think at our April meeting, we'll be looking at the May meeting, and at the June meeting items, I think we'll be at the May meeting. So our goal right now is really to hope get a completed draft by the end of May. That's what we're shooting for right now. We'd love to go forward with our comment period for the month of June, and then take basically July to process those comments and make any amendments to the draft, have a public hearing on August 15th at the Planning Commission, and then come to the first available meeting in September to the board for to approval and to sign off on the plan. So I think we've got a pretty good game plan in line, and I think as long as we just keep kind of following the process, I think it's great that you are engaged and that we have these meetings with you so that you see the plan as it's being drafted and not get one big plan at the end that you have to try to digest all at one time. So hopefully as you see it piece by piece, it'll make the plan development that much easier. So are there any other thoughts or questions you want to talk about this? Otherwise we can jump into a really exciting topic, which is ordinance revision. So
I do have one quick question.
Want to say Thank you, commissioners, and I think Dylan and I will sign off, but we'll see you in April.
Thank you.
Thank you, Robin. Thank you, Dylan.
Thank you.
Thank you.
Tim Bray, quick question for you on the state gas tax.
Yes.
With the EV charging stations, do we get anything off from that?
Not currently. I think that they're trying to figure that out as a way. There's other states that are also trying to figure out how to do that. Think about electric vehicle that doesn't pay gas tax, but the gas tax pays to build the road. And so there's got to be a mechanism. I think they're looking at that. As more of that comes online, I would expect to see more about that. But currently, it might be off the sale of it, but not the charging stations. Maybe the sale of EV vehicles, that's the way that they're going to get it into the highway distribution fund. So a different tax for electric vehicles.
So if you say they're going to do it on the sale, that's just a one-off then, because I purchase it, I pay the fee where my gas tax is ongoing.
Right.
I could keep that car for 20 years.
Right.
You also can have a use tax. You
Pardon
can have a sales tax, or you can have a use tax.
Yep.
Now, the use tax in this kind of instance gets to be really tricky. How many miles did you drive?
Right.
Yeah, that's-
You know, there are ways to do it, but they can be very cumbersome. And so then the return on the investment, you know, it's essentially setting up a property tax system, just that kind of oversight, if you're going to do a use tax for how much you use the roads. But
And the only other way to do it is, you know, when you go to license an EV vehicle versus license a motorized vehicle, there'd be a surcharge that you charge on that license that would come into it. Now, I think, is it fully enforced yet, the sales tax on auto parts? Is that fully come into the funds that are, if I remember right, they're putting a sales tax on auto parts, and that, they were gonna try to move some of that to come into roads, if I'm not mistaken, or in transportation.
Yes, I don't know the exact percentages, Commissioner Lupke, but it is like much legislation. It's not, you know, there.
No, it's.
The next day, it's ramped up over time.
Right,
and
yeah, I don't know what that'll entail, because it doesn't seem like you're getting it from other sources. Just looking at one of the last, I think, out at the Transportation Committee, it didn't look like that was increasing much from your normal funding. And I don't know
No.
if they showed sales tax on auto parts in there, if that was ramping up in that report.
I can get you those what the legislation is, the ramp up over time, 30%
I don't know if it's
sticks
gonna
in my
make a lot of
head.
difference or not, but. So, okay. Other than that, did you have anything else for Tim?
Thank you.
Great. Well, we'll jump into the ordinance revision summary. This, I don't think, will take too long. Just as a reminder, we were back last month at the February Committee of the Whole talking about some proposed ordinance revisions. We went over this document that had the items that were in yellow were the ones that were more housekeeping and cleanup, and the green ones were more substantive. You know, so, and then you authorize us to begin the 30-day comment period. So we were just finishing that up. I know that you guys spent all last month reading through the ordinance and just really digesting it. Were there any other questions that came up in the last month about some of the changes, maybe, if you had any questions or thoughts before we jump into the comments?
Well, I haven't quite got to the end of it yet, so.
Me neither.
Give
So.
me a little more time.
Yeah, I haven't got to the end either yet, I think, so I'm still trying to figure it out. Okay, well, we'll jump into some of the comments, and we received a total of 5 comments, and 3 of the comments were related to Article 25. And Article 25 is the section of the ordinance that talks about the use of animals within residential districts. And I'll go over the changes that were proposed and then some of the comments that we received as far as what some of the questions or concerns were.
To be clear, this is the use of animals?
Yeah, like keeping of animals, like agricultural animals in residential districts.
backyard.
Yeah, how many horses can you have on, a residential piece of property? And so currently, this is in Article 25, it's a very short section of the ordinance. Currently, this only regulates the keeping of animals on lots that are 10 acres or less, so we're not talking larger lots, it's just for those smaller residential lots. The current ordinance allows 1 animal unit to be allowed per 2 per 2.5 acres, and the proposal is to change that to a total of 5 acres to have an animal unit. And as we discussed last month, an animal unit is basically 1,000 pounds, so it'd be a horse or, that type of thing. And then number 2 also allows no more than 0.25 animal units shall be allowed in parcels, 2.5 acres of land or less. So like a 0.25, that allows you to have chickens. So, if you think about a quarter of 1,000 pound, it allows you to keep chickens on the property at the same time. And so the ordinance also requires that basically keeping the animal units must be kept or pastured. They cannot be within 100 feet of any other dwelling. So the first comment received requested that number move from 100 feet to 500 feet. They thought that 100 feet was too close to a dwelling, and they felt that 500 feet would be a more reasonable number so they didn't have to deal with the odors and all that of having those types of animals around. So. Any thoughts on that, going from 100 feet currently? And it's not to the property line, it's to the actual dwelling itself.
So if the house is on the side setback of a house close to it, it's 500 feet from that house?
No, it's currently 100 feet right now.
Currently 100, but
The comments said they thought maybe 500 feet would be more realistic. That seems a little high to me, because I'm not sure you could meet a 500 foot setback.
I'm just thinking of fencing. I'm just thinking of fencing. If you've got 10 acres or 5 acres or whatever it is, and you want to put an animal out there, you're going to have a fence. The animal can be in the middle of this fence. So,
2.5 acre lot size is a pretty sizable lot size.
500 feet wide.
the good point. Good point. But
it's like, say, take for example, like a 2.5 acre lot. If you were to create a new lot, say it's 160 feet wide.
Yeah.
No, I don't know what you could really, do, but so as a reminder though, the ordinance is moves it to a 5 acre minimum to have one animal unit, not 2.5. And then, we would still keep the 100 foot setback, is what we have in the ordinance now, but the 500 foot is what's recommended. So are we okay with the 100 foot the way it is? Just a citizen it's up in Lake Edward Township.
Of course.
We had a situation this summer with this exact situation, and so this was trying to see if we could remedy that. We had a residential development, and somebody had 4 horses on a 2.5 acre lot, and we had, so we're trying to, figure out, they actually moved them. They were required to move the horses, but it was in a pretty residential area where houses were, were a nice little cul-de-sac, and, kind of felt like, that might not be the right spot to have a bunch of horses in your front yard. So that's why we proposed that this would move to 5 acres. I will say we also got a couple comments from other folks, though, 2 other comments that came in that had questions that moving from 2.5, we had 3 comments that felt like moving from 2.5 to 5 acres was unreasonable, and it wouldn't allow folks, they felt that they want to do some homesteading, and to move to a 5 acre minimum for an animal size they felt was removing their ability to be able to have animals on their property, to homestead their property, kind of that perspective of wanting to so they could have a few, keeping it 2.5 acres would allow them to have a few animals on their property, and raising it to 5 would negatively impact the homesteading community. They wanted that, they asked, so there were 3 people independently who felt like that going to 5 acres was not the right number either. They wanted it kept at 2.5. So we have 1 basically for it, and then there were 3 against it, so.
Quick question for you, Chris, is if they're currently allowed and somebody's utilizing the current ordinance, would they be grandfathered in?
Everything, yes, it would just be similar to, if you had a house and that became non-conforming based on setbacks or a change in the ordinance, it become a legal non-conformity. So, yeah, that would technically apply to this too. It'd be a little more challenging to enforce that because I don't know how many horses you had yesterday.
Right.
So, I mean, that would, I think that'd be a hard one to do. They'd have to show, we would require them to follow the new ordinance unless they could give us documented, substantiated evidence that otherwise would support if they were, meeting the ordinance prior to that.
I get the feeling we'd have to do the DNA on the horses, because if one passed, we could bring in another one and we'd have our 4 back, and
It would be challenging, so, yeah, I think we would probably enforce the ordinance, and if people were to disagree with that interpretation of the ordinance, then there's always the opportunity to appeal to the Board of Adjustment, and then to, if they really feel strongly, to appeal to district court.
I think even to change it at this point across the county would be very difficult to go look at every place that has animals.
Well, and we would treat that just like we do all of our other complaints.
Wait for the complaint.
We wait for a complaint. We don't go looking for complaints. They seem to find us plenty.
You're gonna go after them?
Well, we did this summer, and we required them to move 4 horses off their 2.5 acre piece of property, so they had to move them to a different piece of property.
2.5 acres for 4 horses is not much of a paddock.
No.
No, they were in the
Never gonna
driveway.
hit full stride in a 2.5 acre, unless they're running around in a.
They were out in the front yard of these people's house. I mean, it just didn't look right.
What it might be is, 4 horses is too much for 2.5 acres, but maybe a chicken coop is not.
And that's covered by that
It's
.25.
addressed in there.
We have that covered.
It's just kind of tightening it as it gets smaller. And that's because it's gonna spill over onto your neighbors.
Well, this
Sights
was
and
in
sounds and smells.
this was in a really kind of a residential area.
Yes.
And, it wasn't like the 2.5 acres was surrounded by woods. It was right next to the neighbor's driveway. You can see the horse in the driveway in the same picture.
Well, and this plat also had, covenants and restrictions that prohibited that, so they could have resolved the issue themselves if they wanted to. They just didn't want to, so they wanted to use the county instead to get rid of those horses, so.
That's becoming.
What's your recommendation?
I would, based on what I saw this summer when I went to that piece of property and looked at it, it seems like 2.5 acres is, like Tim said, a horse isn't gonna be able to, with a house there and everything, that's gonna be pretty hard for a horse to actually, to run around, and I personally think 5 acres makes sense.
The horse ain't gonna be happy, is that what you're saying?
I think so. And plus, we have a lot of 2.5 acre lot developments where there's just house. And, I think if we would look into those larger lots, I think we would, a lot of, you look at the ordinance and it does talk about how do we, minimize negative impacts between neighboring properties. And I think this is one of those opportunities that I think would do that.
I don't have a problem with 5.
Yeah, I don't either. Do you have a problem with 5, Rosemary?
You want to make it 10?
I would love to make it 10, but we've had a lot of discussions on this already.
We are going to run into some issues, though, because, we now are looking at 2.5 lots, and the ones adjacent to it could be 5, 10, 20 acre lots.
Yep.
And they could have, and they will get the odor, and they will get the.
Yep, anything over 10 acres, we don't regulate that for animals, so it's just those lots that are 10 and smaller. Just trying to want to regulate in those residential areas where people will be more close together.
And then didn't we talk at one point that you have to own the land? Did that ever
Yeah,
come
yep.
into-
I think, there was at one point a situation where they were wondering, trying to like lease land adjacent to it, but then there was a huge wetland in the front to be able to get to the pasture land in the back, so the horse would have to, really trudge through a wetland to get back to, which they're not likely to do. So, I think I think going forward, the interpretation will be, it just applies to the land that you own. And if you want to lease something, that's a different situation. That's not going to apply to this.
And you do have a thing about, like, if it's chickens, there's something about the roosters, or if it's goats, nothing about the billy goat versus the regular goats. You have nothing.
We have no regulation over the types of animals you keep. So if you keep roosters, you keep roosters. If you keep hens, you keep hens. We don't have any regulation over that. And we don't have any regulation over if they, wake the neighbor up at, 4 in the morning. We don't regulate that.
Because I can smell a billy goat from a long ways away.
if that's something you want us to regulate, we sure can
Well,
try, but I
didn't
would
think
recommend
about-
against that.
But I think in going to cities, I think they can regulate the type of, like we're not gonna, if we're gonna have chicken coops in a city, we're not gonna have la roosters or whatever it is.
Right.
Because of the noise that you'll have in a city. But then that's definitely underneath the,
But the people that leave the city to have a chicken out in the townships are go there because they want to have a rooster, right? So, I think we can,
It should be the most strict inside town where the houses run 50-foot lots and you're right on
Yes.
top of each other. And the bigger the lot size, the more noise you can afford. And the more you move outside of an urban center, the more noise and smells you are expected to.
Yeah, it's part of being out in the woods.
And if you go and move out into Commissioner Corning's district down south and you want to complain about the smell of manure,
You're not getting very
that should
far.
fall on deaf ears.
yep. So any other questions on animals in residential districts? A lot of discussion about that. We did receive another comment too about concerns of making an update to Article 40.7, which is our off-premise signs, the billboards. So just as a reminder, we did make some changes, proposed changes to that ordinance that says that if you are going, the current ordinance says if you're going to erect a new billboard sign, one needs to come down. So that's the current ordinance. And so one of the modifications made was to say that a sign only can come down in an area where the county has jurisdiction over signage. And so, this came from Franklin Outdoor Advertising, and it's,
Wasn't surprised.
no, and we expected those. So their comment is that they were part of the discussion back in the, mid-90s when this ordinance was modified. At that point, Crow Wing Township was within the county's jurisdiction, and I believe Irondale probably was too at that point. And since then, those two townships have chosen to go on their own. And I did follow up with Crow Wing Township, and they have the same policy as the county does, that no new billboards unless one comes down. So they're not going to be, they wouldn't be adding more signs according to their current ordinance. I haven't called, I should probably get a hold of Irondale and ask them that same question to see how they handle, if they have any regulations towards billboard signs or not. But their comment was that those signs that were an off-premise sign in the inventory at the time of 1995 should be considered inventory that they can remove to put up a new sign in its place. So they disagree with that verbiage that it needs to be within the county's jurisdiction for a sign to be removed.
Personally, I don't agree with them.
Huh?
Yep.
Yeah, but things change. You can't, there could have been an ordinance done back in 1980, and just because it was in 1980, doesn't, we should be able to change ordinances because we have changed, our county has changed, the uses of our county has changed.
What do you think?
Based on, obviously we can talk about Irondale and Crow Wing, but it doesn't govern Baxter, Brainerd, any other cities that might put those signs up. So, I'm not as concerned about the two townships that are on their own as much as the cities, where they could take a sign down and the next month another one come right back in that same spot. Again, we have no ability to regulate that. So the question is, are we concerned with what's happening in the cities, or are we just focusing on just the sign accumulation, or the movement of signs in the township, I think is the question. So I think there's kind of two ways to look at that. Because we can't really, there's nothing we can do in the cities to ask, to require them to not allow new billboard signs.
What if we allowed for the fact that the one that's coming down can be in the county's jurisdiction, and the one that's going up is in a different jurisdiction? In other words, we could live with that. What we couldn't live with is where the one that's going down is in another jurisdiction and the one that's going up is in ours, right?
That's what this ordinance is prohibiting, is that exact thing. And so if they wanted to take a sign down and then have Baxter put one up, we wouldn't even be involved in that conversation.
We don't care.
We won't even have any conversation.
Got it. Okay.
That's the difference.
And like in Pequot, where you go from Nisswa all the way up north of Pequot, you got now with the highway through there, you got that large area. Well, Pequot addressed that with their own sign ordinance and what they will allow or not allow in that area.
Right.
And they have the control over that. It's not for us to decide that anything can happen there.
Same in Nisswa, when you go up 371 through,
Yeah.
that's your corridor is
That- yeah.
unorganized up to Nisswa, and then from Nisswa, Pequot, and then that corridor to Jenkins, and after that, you're pretty much out of the county at that point. So that's really where this.
That's kind of the corridor. I mean, you
But
have
their comments mentioned that they are focusing, trying to put more signage up on 169 now and on 18 also. So, not just 371, because 371 I think is pretty filled in for the most part. I think they're looking for other areas to put signs in.
But Garrison does Garrison have their own rules? I mean, they have their
The
own.
city does, I don't know what the city does, so we would just be focused on everything that would be outside the city of Garrison, and we would be just talking Garrison
Yeah,
Township.
it's only in our jurisdiction that
Yeah.
we need to worry about it.
Correct. So should we
See why
leave?
they would want to change, just for increased flexibility and ease of their running their business, but they must run into this everywhere.
You would think so, but.
I would think so.
You'd think so, but it sounds like,
Municipality to municipality,
Yep.
what their policies are.
Right.
along a
And
certain stretch
there's
of road.
there's a statute that they sent that, 173.01, that says that, I read it as saying that signs can be regulated. And I think they were trying to say maybe that signs should be regulated to a minimum, but it just says signs can be regulated, in my opinion. So I don't know if it really helped it really helped their case or not, but
Would you change it?
I think the way that it sits today would, I don't know what happened in 95, and, and Crow Wing Township could change their ordinance tomorrow to allow billboards everywhere. So that's the question. I think leaving it as is makes sense, and, I just think it makes sense.
Anybody want to change it?
No.
I found it kind of interesting. I've got a couple townships that are opposed to billboards, but in the county south of them, they're all advertising on billboards, businesses and even the township. So
Right.
I don't, it just kind of struck me as a little odd that they're trying to eliminate them, but yet they're.
Right. Not in my backyard situation.
Yeah.
They're advertising on them?
Yeah,
Yeah, just
Out
don't,
of county, yeah.
just don't put it in my yard.
that's what,
What county is that?
And I think it's important to remember too that these signs don't just go anywhere. They are regulated by location and setback and, proximity to schools and homes and that. And so the commercial, you have to be commercial to even consider putting a sign up. So you couldn't do it residentially. You got setbacks to homes, 500 feet away from homes and schools and, daycares, that sort of a thing. So they are regulated from that standpoint. It's just a question of, what's the perspective of the signs coming down? I think you've answered that question, so. One change that we made to define that an off-premise sign can consist of a V sign, so there can be signs on both sides. They didn't really question that. They wondered what the intent was, and just to define that on those off sign, my opinion, I would rather have a V sign with two face both ways than two signs with one face on each sign. My personal opinion. I do think it reduces the signs that we actually would need in the county. Does that make sense for allowing those V signs? Because it's defined in the ordinance already. We just say that these off-premise signs can be a V sign.
But you might even think about requiring it.
Hmm?
You want fewer billboards in the county? Require it.
Yeah, right. Yeah, right.
In
We
the
could,
line of
we could
sight.
change it to a must.
The line of sight works for the Vs in the right places, and I don't think they'd put them where they,
Right.
double-sided where that line of sight,
Right.
The one I see every day is the one in Pequot there, and it's V'd, and so you can see, because it's 4-lane, it's wide,
Right.
it's where that sign should be.
We're seeing some that are being proposed, like down by Garrison, where it's gonna kind of butt up to a bunch of trees. And so a V wouldn't make sense there, probably. It would just make sense for the one-sided, so. And then the other provision that we just wanted to clarify, that if a sign is constructed an off-premise sign has been erected, and then a house or a daycare or that is built afterwards, and it's within 500 feet, that sign is still a legal sign and can continue without having to be, so it's considered a legal nonconformity in that, where it's at there. And then the last one was just to prohibit those digital or LED-faced off-premise signs on all county and township roads. So.
On all what?
County and township roads. We would prohibit those digital LED-faced signs. And their comment was that they think there should just be spacing between those digital faces and not prohibit them on a county or township road.
Conflicts for citizens of a passive sign with a light that is sitting there shining in the same direction all the time,
Yep.
as opposed to a television screen flashing into my bedroom with all sorts of colors and motion and change. I know which one's going to be more objectionable.
Right. I think people are okay with having that on major roads, the 371s, the 169s, but I live on a county road, and I'm not sure I'd want to drive by a big blaring TV every day. And when you more along like 371, the corridor, that we've got north of First Assessment, and then even that area on 169, there's not residential and there's commercial to commercial to commercial, whereas in like I'm up in First Assessment, you've got residential, small patch of commercial, and resident, more. I'm not sure that, even if they met that 500-foot setback, that would still be, I think.
Well, there's two, I think, is there
Problematic.
two of them on 3 on the way up? On 3, there's, before you get into south end of Cross Lake, there's a couple of digital signs there.
Yeah, there is, yep.
And if that ordinance goes in, no digital sign on County Road, but that's a CASA road, is that?
It wouldn't matter, but they would be able to maintain. I mean, they were there, they were legal, and they put it up so that we couldn't go back and make them change that. It would just be no new ones going forward.
Right.
If a tornado took it out, they would not be able to rebuild it.
Yeah.
Correct.
It's a legal non-conforming use, and so if the non-conforming use stops, so does the legal non-conformity.
They would technically have 6 months to get a permit, and there's ways to go about it, but the idea is that when that non-conforming use is terminated, that it can.
And that's only for signs off premise, that's not for an on-premise sign for a business.
This is
that
only
says,
this is only talking off premise.
I want to have a sign on my property,
Yep. Only off premise signs for this, yeah. Are there any other, so those are the comment period does run through Friday, so we would expect, a few more comments, but I thought it'd be nice just to come in and summarize what we had heard so far. I haven't heard a lot of, I'm guessing we're gonna get some comments from the DNR coming up, they'll probably be here by Friday, about the changes to Article 11. And then, but I haven't heard a lot of other people, calling or saying they wanted to have some, so it seems like it's going okay. What I'd like to do is, based on our conversation today, is hold a public hearing for this at the April 18th Planning Commission meeting, and then come back to you guys on May 14th for final review and hopeful adoption or whatever modification you want to make. And as a point, Thursday, we're going to have a work session with the Planning Commission at 3 o'clock, and we're going to go through the ordinance and the comments, everything that we've talked about here with them, so that they know what's going on, and they've got a copy of it, so they'll peruse it and be able to answer those questions. But I want to be able to go to them and say, for the most part, you guys are pretty content with what's being put in front of them.
Will our ears be ringing on Thursday?
Well, I don't know. That I can't speak towards.
Is there anything else?
That's all I have.
Mr. Chairman, that's all we have. Do you have anything else that you have for us?
Hearing nothing,